This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Well, with all the wind and the cold that we've been having here on Delmarva, you have probably found yourself more than once blinking and wiping your eyes simply after being outside. However, for some people, that's a year-round problem.
It's caused by a condition called dry eye syndrome, or DES. And Dr. Catherine Smoot of Chesapeake Eye Center in Salisbury, Amberlin, joins us this afternoon to tell us more about this very common condition. Thanks for joining us this afternoon.
Thank you for having me.
Okay, so first of all, let's just start off. What is dry eye syndrome?
Okay, so dry eye syndrome is actually a variety of conditions. And it's a problem where you have insufficient coverage of the corneal surface, which is the clear window of the eye, with your tears. So that's really important because your cornea is really like a Thomas English muffin with nooks and crannies. And you need that tear surface to fill in those nooks and crannies to give you a real smooth surface so you have great vision. Because what happens if you either don't make enough tears, which is one component of dry eye syndrome, or one type, or the tears you make don't hang around long enough and evaporate, that corneal surface is exposed. And then you start getting all the symptoms and the problems with dry eye.
Like an English muffin. I'd never heard that.
Nooks and crannies.
Is there anybody in particular this affects more than anybody else?
Yes, it does. I mean, it's a condition that tends to worsen as we get a little older. And in fact, about 15% of the population over age 60 will have this condition. And people have certain diseases such as rheumatoid arthritis, Sjogren's syndrome, other sort of inflammatory conditions can have very, very severe dry eye. Hormonal status, women are more commonly involved, experiencing these symptoms than men do. People who have eyelid margin disease or conditions such as rosacea can really have a problem. And the severity may be nothing more than a little irritation of your eyes, burning, stinging, redness. In fact, a lot of people come and say, oh, I've got allergies, my eye allergies, but it's really not. It's dry eye syndrome. And is what can really happen with this, if the disease progresses, you can get foreign body sensations, you can get exposure of that corneal epithelium that can lead to severe burning, corneal scarring, changes in your vision. Ooh. So as the disease progresses or you get more clinical findings, it becomes a much greater issue in your life.
So aside from the irritation and the burning and everything, are there any other symptoms?
Redness, tearing. People say I have tearing. Well, why do you have tearing if you've got dry eye syndrome? Well, because is what happens, your tears are made on the upper outer corner and drain into the center. If that cornea is exposed, it sends a message that make more tears. So you keep trying to make more tears, but they're not doing their job, so they start overflowing. And a lot of times they aren't doing their job because that tear film may be out of balance. Your tear film is really like a club sandwich. It's multi-layered. It has oils and mucins and aqueous, and they have to be in just a nice balance to do their thing. And if for some reason that gets out of balance, particularly like the lipids or oils in that tear film, they just don't hang out and do their job. They're kind of lazy. So there are different things you can do.
Right.
If you
I was going to ask you about that. Are there treatments for this?
There are different treatments. One of the things commonly we say is just a lid margin hygiene, because people who have lid margin disease or conditions can frequently have tear film imbalance. So most people, when they wash their eyes, will go like this.
Right, yeah.
And so what we generally suggest is either use over-the-counter lid wipes or just a washcloth with some water. Some people say a little baby shampoo. Open your eyes when you take your shower and just wash the base of the lashes. That gets the oil glands. In some cases, the lid margin disease may need more treatment. Use a little antibiotic ointment if your doctor prescribes it.
Right.
Artificial tears are a mainstay over the counter. And everybody said, what's the best tear? They're all a little different. You have to experiment, see what works best for you.
Okay.
In more severe cases, there are gels you can use, which are thicker, longer lasting tears. And in really severe cases, ointment at bedtime. You can use humidifiers. As the disease progresses, there are a couple medications that are now available. Restasis and Xiidra are the two big medications that are available. In some cases, your doctor may say topical steroids.
Right.
Certainly treating the underlying medical condition, you know, your arthritis, trying to get that under control. And in really severe cases, there may be surgical indications such as with punctal plugs, cauterizing, you know, more advanced
But
ophthalmologist.
talk to your ophthalmologist.
Talk to your eye doctor and find what is best for you.
Thank you, Dr. Smoot.
Thank you.
And if you would like to read more about dry eye syndrome and Chesapeake Eye Center, just go to our website, delmarvalife.com.